Hello, my name is Dr. Barret Bulmer. Pugsley and I will demonstrate the important aspects of performing a cardiovascular physical examination today. In most instances, you want to have a systematic approach working from either the head towards the tail or from the tail towards the head. And today's demonstration, Pugsley and I will start with his head. So we're going to begin with evaluation of his eyes. We know that systemic hypertension may produce acute blindness, changes within the retina, absence of pupillary light responses. So in many cases, we'll try to judge a menace response for both eyes. We may need to actually assess his pupillary light responses and perform a fundic exam. The second aspect in assessment of the head will be evaluation of his mucous membranes. And for some dogs like Pugsley, it's sometimes difficult to see them. But we want to look at his color, the capillary refill time, assess the degree of moistness. After inspection of his mucous membranes, we want to pay attention to his jugular veins. We know that alterations that may occur within the jugular veins with right-sided heart failure may include jugular pulsation. We may also identify a positive hepatojugular reflux suggestive of right-sided or early right-sided heart failure. So after we evaluate the eyes, the mucous membranes, and the neck, we'll move on to assessment of the thorax. In many cases, if we're going to perform cardiac auscultation, we'll begin with palpation of the cardiac impulse just via our hands for detection of the heart rate, the rhythm, and the presence or absence of a cardiac thrill. Generally, we'll begin our cardiac auscultation at the area of the apical beat. That's generally at the location of the mitral valve. We'll want to listen with both the diaphragm as well as the bell of our stethoscope. So we'll begin with palpation of the precordial impulse. We'll begin our auscultation at that level while simultaneously palpating the femoral pulse quality. We're going to detect the transient heart sounds. We're going to listen for murmurs, gallops, or arrhythmias. We're going to then move rostrally and dorsally up underneath the armpit, essentially towards the heart base as the S2 heart sound increases in intensity. Generally from the left basilar region, we'll sweep along the sternum. It's an important region to listen for cat murmurs, both the left on the sternum and to the right, and then we'll move to the right side of the chest to complete our auscultation. The same technique should be performed with the bell of the stethoscope. So on my stethoscope, we flip the stethoscope over and repeat the procedure with the bell. The bell is better for detection of gallop sounds, lower frequency sounds. After completion of cardiac auscultation, we'll also want to perform thoracic auscultation, so it'll be important to listen to the right as well as the left side of the lung, listening for increased or decreased lung sounds. Finally, we'll begin with assessment of the abdomen, assessing Pugsley for the presence of ascites or a fluid wave, and we'll complete the cardiovascular physical examination with assessment of both the right and the left femoral pulses for their strength, whether or not they coincide with the heart rate during auscultation, and the equalness between the femoral pulses. For more information on performing a cardiovascular physical examination, please visit cardiaceducationgroup.org.